Hi, everyone, and welcome back to Nurses Notes 101. I'm Alexa. So today we're going to be going over the NCLEX exam category, Safe and Effective Care Management. So in the next slide, here we can see that management of care is 15 to 21% of the exam. Within this section, there are a bunch of key topics that we want you to look at, including advanced directives, delegation, which I feel like tends to be some people's least favorite. So delegation and supervision, examples of other RNs or LPNs, time management questions, effectiveness of care questions, initiate, update, and evaluate patients' plan of care, patients' rights, advocating for clients' needs and rights, multidisciplinary collaboration, for example, physical therapy or nutritionists, approved terminology when documenting can be a question as well, prioritizing care, which is always a big group of questions based on acuity, recognizing and reporting patient ethical dilemmas, and recognizing self-limitations and skills of others, which could be another reason to delegate tasks or need supervision. So in the next slides, I will have examples of questions that I have made. So I want you guys to look at these questions. I would say take about 30 seconds to read the question, look at the answers, and kind of think about what I'm asking. So I made these questions independent of the exam, but I took them with references from the NCSBN in mind. So these questions are pretty legit in my eyes, but take them with a grain of salt and let me know what you think. So first one here, in which client situation would it be best to use an advanced directive? So this question is asking about advanced directives. Go through the examples A, B, C, D, and let me know which one is different from the rest. So let's just start there. So looking at this question, we can see that answer D actually highlights that the client is in a comatose state. Advanced directives are utilized when an individual is unable, for example, in a comatose state, to make decisions for themselves. So they appoint someone who can make decisions for them. All of the other above examples, so A, B, and C, do not highlight that the individual is in a comatose state. Thus, the answer to one would be D. Question 2. This question is also about advanced directives. A single woman is admitted to the hospital for an emergency bowel surgery. The client asks the nurse who will make decisions for her in the case of something going wrong during surgery. Which of these is the correct course of action for the nurse? So take a moment to look at the options, A, B, C, and D. So this question, if we think about it, it's asking, what does the nurse need to assist this client with related to advanced directives? Is this something that is within the nurse's scope? Is going over advanced directives something that a nurse is able to do? Is this something that she has to delegate? Is it not within her scope? So these are kind of what the answer options are asking. So A, the nurse should not get involved. B, the nurse will say that she can act as the healthcare proxy. C, the surgery should be delayed because there is a lack of delegation and a lack of advanced directives. Or D, the nurse would educate the client about advanced directives, assist in the form, and making sure they're on the client's medical chart. If you guys chose option D, that is correct. So it is in the nurse's scope to go over advanced directives with the client, and it is actually one of our most important jobs to do. This is not something that we should pass to individuals to passing the buck, especially with this, can have things get lost in translation. And option C, we would never want to delay an emergency surgery. So the questions that most people love to hate, number 3 is a delegation question. And the next 3 examples I have are delegation questions. So a client post-MI is receiving IV heparin. What instructions would you give the nursing assistant to help with the client's daily activities? And this is another one that some people love to hate, so let's all that apply. I know on my exam particularly, I think half of them were select that apply. So if I could give any key of advice, just get used to select that apply questions. So delegation, nursing assistant, what is within a nursing assistant's scope of practice? For someone with the precautions of being on IV heparin. So look at the answer options that we have, A, B, C, and D, and let me know what you think. Is there any of these options that jump out to you that might be inappropriate for someone on IV heparin? I can see one that definitely jumps out to me now. Okay, so looking at the answer options, I would say that all of them are correct except D. So A, B, and C are the correct answers. D is not. If someone is on IV heparin, you do not want to use a rectal thermometer. The rectum is a very vascular area and it can be prone to bleeding, so you would want to just use an oral thermometer. For A, B, and C, you would want to, yes, use an electric razor, not a straight razor. Straight razor puts the client at more risk for cuts. You'd want to use a soft bristle toothbrush, not a hard toothbrush. So B is correct. And then C, when the patient has to be positioned in bed, you want to use a lift sheet. You don't want to be too rough with them because they're at enhanced risk of bleeding and bruising. And all A, B, and C are within a scope of a nursing assistant. There is no assessment there. There is no medication giving. It is kind of just helping the client with the daily activities. So good job. Question 4, another delegation. A client has COPD. Which intervention to assist with airway management could you delegate to the nursing assistant? So again, think about what's in a nursing assistant's scope of practice. This is only a one option choice. So go through answer options A, B, C, D, and let me know what you think would be the best one. Can a nursing assistant auscultate breath sounds? Can a nursing assistant instruct a client about effective coughing? Can a nursing assistant teach utilizing a medical tool or medical device, like an incentive spirometer? So B, C, and D are all incorrect. The only thing that can be delegated to a nursing assistant in this question is A, assistance with patients sitting up on the side of the bed. This is considered an activity of daily living, and nursing assistants can help with that. The last question, an experienced LPN is providing care for an individual with a respiratory ailment. Which actions are within the scope of practice for an experienced LPN? Select all that apply. So we need to think about the scope of practice of an LPN, and then we need to look at the answer options that we have and see which ones relate to that and which ones are outside of the scope of practice for that LPN. So can LPNs complete admissions assessments? Can LPNs administer medications, specifically in the route of meter dose inhalers? Can LPNs auscultate breath sounds? And can LPNs evaluate the patient's technique with the MDI? So the correct answer for this is B and C. So due to the extensiveness of an admissions assessment and keyword assessment, even an experienced LPN should not be and cannot complete the admissions assessment. So A is incorrect. Due to the root of inhalation being MDI, the experienced LPN can give the medication, and they can also assess the patient post-medication, so auscultate breath sounds. The experienced LPN cannot, however, evaluate patient's technique with MDI. That would be more of a nursing scope of practice. But great job. I hope these questions assisted you in some of the potentials that you could get during the NCLEX exam. And please give me feedback if you have any other things you'd like to discuss.